My name is Hannah. I'll be your student nurse today. I have already applied hand sanitizer and previously washed my hands. Can I please check your ID band? Okay, thank you. And do you have any allergies?
No.
No. Okay. Today I am assessing a 35-year-old female who has average sexual development, has a great level of consciousness, shows good facial symmetry, and has a happy mood, showing no signs of distress. She has an average nutritional status, however, seems to have a BMI of 32. She has great posture, good gait and coordination. Her speech seems to be intact, and she is dressed appropriately, showing that she has good hygiene. Now I will test the patient on level of orientation. Do you know your full name?
Erin Doyle.
Okay. And do you know where you are?
In the doctor's office.
And do you know why you're here?
For a checkup.
Okay. And what is the date today?
September 23rd.
Okay. Now I will test the patient's memory. Can you repeat these 3 words back to me? Apple, orange, grape.
Apple, orange, grape.
Okay. And what did you have for breakfast this morning?
Eggs.
Eggs. And then what is your anniversary?
June 24th.
Okay. Now I will test the patient's judgmental thinking. If you were to see an elderly woman trying to cross the street, what would be your instinct reaction?
To help her.
Okay. Let's say I were to use the term, it's raining cats and dogs. Do you know what that would mean?
It's raining heavily.
Yes. Do you know who the president is?
Donald Trump.
Yep. And can you count backwards from 10 to 2 by 2s?
10, 8, 6, 4, 2.
Good. Now I will test the patient's stereognosis. Can you close your eyes and put out your hand for me? Can you tell what is in your hand?
This is a pencil.
Okay, good. Now keep your hand out and keep your eyes closed, and I'm going to draw a number on your hand, and you tell me what I'm drawing.
8.
Good. Now I will poke you with something sharp or dull, and you tell me which is which.
Dull. Sharp.
Good. Now I will test the patient's proprioception. Can you stick out your hand once again for me? Let's just say that this would be considered sticking your thumb out, and this would be in. Close your eyes and tell me which one I'm doing.
Out. In.
Okay. Now I'm going to do the same thing with your big toe. This would be considered pointing it up. This would be down. Close your eyes and tell me which is which.
Up. Down.
Okay, good. Now I will test the patient's reflex. The upper reflex I will be testing is the biceps reflex. I would have the patient put their arm in my hand, strike their reflex, and hope to see a reaction in their forearm. Then I would strike their patellar reflex, hoping to see an extension in the leg. And then, can you lay flat so that I can do the plantar reflex? And then I would take my pencil, go up the leg like this, and or up the foot like this, and hope to see a reaction there. Then I will do the cerebral thinking. Can you touch your fingers to your thumb for me? Good, and then go back. Now can you touch your finger to my finger, touch your nose, and then touch my finger again? Good. Can you place your hands on your thighs and go up and down, back and forth a few times? Okay, good. Now can you lay flat out and put your heel to your opposite shin and rub it up and down a couple times? Okay, good. Now I will assess the patient's gait and coordination. Can you stand up, walk over there, and then walk towards me heel to toe? Good. And now stand still. Try to keep your balance while you have your eyes closed. And then try to keep your balance while I nudge you a little bit. Okay, good. You can sit back down. Now I will be assessing all the cranial nerves of the patient. Cranial nerve number 1 is olfactory. To assess olfactory, I would have the patient smell something and see if they can tell what it is. Can you tell what this is?
Lavender.
Yes, it is a lavender candle. Cranial nerve number 2 is optic. I would test the optic nerve by doing a nearsighted test of giving them something close up to read. Can you tell what this recipe is?
Fathead bread.
Good. And then I would do the farsightedness by doing the Snellen chart test by having them stand 20 feet away and read what is on the chart. Then I will do the peripheral vision test, cover the same eye as I do on the side. Good. Let me know when you see my fingers coming in.
Yes.
And let me know when you see them coming in now.
Yes.
Okay, cover the other eye. Let me know when you see
Yes.
them. And let me know when you see them.
Yes.
Okay, good. Now I will assess cranial nerve number 3, the oculomotor. I will do the cardinal field test, which also assesses cranial nerve number 4, the trochlear, and cranial nerve number 6, the abducens. Follow my pen with only your head and not your, or with only your eyes and not your head. Good. I've also noticed and observed that she has no lid lag, no eye drooping or eyelid drooping. And now I will do the Perla test, which is testing the constriction of the pupils. And they both constrict with the light in each pupil. Now I will assess cranial nerve number 5, the trigeminal nerve. I will test the mastication. Can you please write down for me? Good. And then close your eyes and let me know if you can feel this.
Yes.
Yes?
Yes.
Okay. Then I would typically do the corneal reflex by taking a cotton swab and lightly brushing it across the cornea to see if they react to that. Now I will assess cranial nerve number 7, which is the facial nerve. Can you smile for me and frown? It looks like they have good facial symmetry, which was also assessed in the general survey. I would also assess taste in this cranial nerve by giving them something sweet or salty to taste. Her eyes also look moist and her mouth looks moist. Now I will assess cranial nerve number 8, which is the acoustic nerve. I would do certain tests to test the hearing, like the Weber test, which is taking the tuning fork, striking it on the table, and putting it on their forehead to see if they can feel the vibration. Then I would do the Rhine test by striking the tuning fork and putting it on their mastoid process and seeing if they can hear it. And if once they stop hearing it, put it to their ear and see if they can hear it then. Then I will do the whisper test. I'm going to ask you to face that way and cover your right ear. And I want you to repeat the words that I say to you.
1, 2, 3.
Okay, good. And I would do that with both sides. And then lastly, I would test the balance, which was already assessed in the general survey. Now I will assess cranial nerve number 9, which is the glossopharyngeal. Can you swallow for me? And I would observe that she can swallow. Then I would also assess taste here, but that was already assessed in cranial nerve number 7. And then I would also do the gag reflex, which would be taking a tongue depressor and putting it on the back of their throat to make sure that they have a reaction to that. Then now I will assess cranial nerve number 10, which is the vagus nerve. I would do the vasovagal response by making sure that their heart rate and blood pressure do not exceptionally decrease while they are holding their breath. And then I would assess their speech, which was already assessed in the general survey. And then I would also do a test for the rise of the uvula and the hard palate. Can you please stick out your tongue and say ah?
Ah.
Okay, good. Now I will assess cranial nerve number 11, which is the accessory nerve. The accessory nerve, I would ask the patient to shrug their shoulders and then shrug them against resistance and then turn their face side to side and then turn it against resistance. Okay, good. Lastly, I will assess cranial nerve number 12. I would ask the patient to stick out their tongue, move it side to side, up and down, and then stick it straight out and make sure that their tongue is within the midline. And that is all.